All right, it is 8:15. As we head into fall, doctors are preparing for more cases of respiratory illnesses. And the tricky part, a lot of these illnesses have overlapping symptoms, so it can be very tough to know what you're dealing with. And joining us this morning is Dr. Ada Pariser with Holland Hospital, here to help break us down the differences and talk about what we can do to stay healthy this season. We know we're starting to get into cold, flu, RSV, COVID season. So let's first start there. What are you guys looking at as going to be like the one thing that you guys are most concerned about this season?
Yes, and thank you so much for having me this morning. So I'm Ada Pariser. I'm a board certified family doctor with Holland Hospital in Hudsonville, and we have been seeing a rise in rates of these viral illnesses in Western Michigan. So COVID, we'll start seeing flu soon, RSV, kind of some of the heavy hitters that you already mentioned. You know, last year we had a really severe flu season. People were getting really sick, and across the nation we even saw more children dying from flu-related illnesses than we had in previous years. So we are really trying to get the word out that we want people to be vigilant, pay attention to their symptoms, and do what they can to prevent themselves from getting sick this year.
Yeah, especially as those kids are now back in school. They're kind of mingling with the other kids and whatnot. You know, sometimes we can see that sometimes schools become a breeding ground for those germs.
It's true. It's true. Yes, the little ones are all sharing their toys again in the classroom. The college students are back in the dorms. And, you know, as the days get shorter and colder, we spend more time inside together in close quarters with our loved ones, which is great for social connection. Sometimes does spread viruses, though.
Yeah. So let's start with prevention. What can people do to maybe avoid this in the first place?
Yes, we would love to see people preventing this in the first place. So definitely washing your hands, you know, reviewing proper hand washing technique. Wet your hands first. Get enough soap to cover all the surfaces of your hands, including between your fingers, rubbing your fingernails into your palms, and then rinsing your hands off, drying them thoroughly, and using that paper towel to turn off the faucet. Also, other kind of common sense things like try not to share food, beverages, forks, utensils, things like that, especially once we get closer to the holidays. And then the best thing you can do to prevent spread of these viruses or contracting these viruses in the first place is getting vaccinated.
Okay, yeah, and of course a number of vaccines out there already. And there's a new strain of COVID this season. Is that what I'm understanding?
Yes, there is a new variant called the Stratus variant. So similar to other variants of COVID that we've seen in the past, we tend to see people getting those fevers, chills, body aches, congestion. But in addition, we've been seeing people get some gastrointestinal symptoms, upset stomach, even some diarrhea. So we want people to really be on the lookout for those symptoms and talk to your doctor about getting vaccinated.
Okay.
Yeah, and a lot of things that you're talking about, you know, remind me of the flu. So how do you know the difference between, you know, what medication to take and all those things when you maybe have influenza or COVID?
It's a great question, and it can be really hard to tell the difference just, you know, on your own at home. Certainly there are lots of at-home tests available at pharmacies, especially for COVID. Consider stocking up on those, having those available at your house. But we know also that catching the symptoms early, particularly if you're someone at higher risk of getting severe illness. So if you have underlying lung disease like asthma, COPD, if you're diabetic, if you're immunocompromised, like you're a cancer patient undergoing chemotherapy, or if you're someone who is otherwise healthy but around others that could be at higher risk, going to get tested and letting your doctor know if you test positive or if you test negative for COVID, think you might have the flu. Talk to your doctor then as well, because if we catch it early, there are some medications that sometimes can help shorten the duration of your illness.
Yeah, we've talked a lot about students in the classroom. We've got little kids back in school, you know, kids in general just back in school. But what would you say to those parents, you know, who have those kiddos going to school every single day? What would you say to them as they continue to send their kids off? And what would be the best thing to tell their students as they're at school?
Yes, I mean, I would definitely encourage parents, you know, if you have a little one that is 6 months or older, get them vaccinated. It really is the best way to prevent the spread of these illnesses. And then just practicing good hand washing technique at home, trying to work with kids to make sure they're washing their hands well, reminding them to do those things, washing hands when you get home from school, things like that.
Yeah.
Being sick can be scary.
Yes.
At what point do you suggest to families that, okay, you know, maybe you did your time at home trying to treat this, that you come into the doctor?
Yes. Certainly, if you are having chest pain, shortness of breath, lightheaded or dizzy, if you have a high fever, 104 or higher, we want you to seek immediate medical care. But if you are not having those kind of urgent symptoms, but you're sitting at home and you are just not feeling right, or you are feeling nervous, or you know you're at high risk, please give your doctor's office a call. We are here to help keep the community healthy, to help, try to quell those fears and help you get back on your feet as fast as we can.
Yeah, we're a little bit before the first frost of the year, which means a lot of folks are having those allergy symptoms, those seasonal fall allergies. It can also be kind of hard to tell the difference between a little sniffle that has to do with the flu, COVID, one of those, or maybe a sniffle that has to do with the pollen outside. How do you tell a difference?
Yeah, it's a great point. We have definitely been seeing more allergies in our clinics as well. You know, allergies, as annoying and frustrating as they are, they don't tend to come with that fever, a temperature of 100.4 or higher. They don't tend to have body aches, the fatigue, sick to your stomach, kind of those symptoms that we tend to see more often with a viral illness. Definitely, if you're having ongoing congestion, sniffles, watery, itchy eyes that are not going away, please talk to your doctor about that too. We also treat allergies, but like I said, they don't tend to have sort of that just overall blah feeling and fever that comes with those viral illnesses.
Yeah, absolutely. You know, as we kind of wrap it up here, what would you say to the people? What's your one message for them as we head into fall, winter, RSV, COVID, respiratory illness season?
Yes, my one message is stay vigilant, pay attention to how you're feeling, wash your hands, and get vaccinated.
Okay, well, thank you so much, Dr. Parieser with Holland Hospital in Hudsonville. We appreciate your time this morning.
Yes, thank you for having me.